What is all-on for dental treatment?
All for dental treatment is the rehabilitation of a jaw with no teeth with dental implants, 4 dental implants with a screw retention, full art bridge restoration.
How is all-on-4 different from traditional dentures or implants?
The all-on-4 design is mainly used for patients having less bone on specific sites. There are some anatomical landmarks we try to avoid during the placement of the implant, and actually all-on-4 concept is designed for this purpose. On the upper jaw, we try to avoid maxillary sinus, and on the lower jaw, we try to avoid the nerve going inside the mandibular canal. While placing 4 implants, we place 2 implants on the front vertically and 2 implants on the back in a horizontal fashion, like in a 45-degree angle. By doing so, we extend the exit point of the implant. Furthermore, to extend the dental bridge we are placing as much as to the back we can.
Are all-on for restoration removable?
They are not. We place an all-on-4 restoration on the implants with a screw retention system, and the holes for those screws are closed with a restorative material. And if there is a need to remove them, a dental professional can of course remove them, but for the patient's daily routine, they are not removable.
Who are the people are good candidates for all-on-4 treatments?
For all-on-4 treatment, patients who have less bone on the back and more bone on the front area are the good candidates, because there is good bone on the front area of the jaw to place vertical implants. That's not a problem. But when it comes to the back, the need of angled implants come in handy for those kind of patients. So if there are anatomical landmarks to avoid, and if there is less bone on the back, all-on-4 treatment would be a better choice.
Is the all-on for treatment is painful?
It is almost the same as another dental treatment involving implants. Aftercare is very crucial when it comes to evading the placement of the implants without any complications. The patient has to follow the instructions doctor tells him or her to do, and if it is taken care of good, then we expect no problems.
How long does it take to recover from all-on-4 dental treatments?
After the placement of the implants, a temporary bridge is placed on the implants, and a typical healing procedure for the implants almost takes a week or 2 under good medication is provided. Of course, a good aftercare is performed by the patient.
Are there any age restriction for all-on for treatment?
Every patient that reaches to adulthood is a candidate for all-on-4 treatment. Of course, it depends on the case itself in terms of the bone volume.
And can I brush and floss normally with all-on-4 implants?
Yeah, of course. You're supposed to brush your teeth as usual, but since an all-on-4 restoration is a bridge restoration, there are empty areas under the restoration, so these areas has to be cleaned properly also. We recommend patients to use pressurized water applying devices. These are called aquafloss devices to clean these areas, along with sonic and ultrasonic toothbrushes provided by different brands.
Can I eat all types of food with all-on for dental treatment in first month?
At the primary healing stage of the treatment, we expect patients to go with softer food to prevent wound size to be traumatized. After this primary healing process is finished, the patient can consume all variety of foods without any problems.
What is full mouth treatment?
Full mouth treatment is a very broad definition of rehabilitation of a full jaw with dental materials and implants. Full mouth treatment can involve just placement of the implants or replacement of missing teeth with dental bridges by using existing teeth. So it's a broad spectrum of treatments combined together as a term.
When is full mouth treatment necessary?
Full mouth treatment is necessary when there are too many areas to rehabilitate in a single jaw, or the patient is completely edentulous, having no teeth at all to chew on. At this stage, we always prefer to rehabilitate the patient with dental implants. But of course, there are traditional ways to rehabilitate an edentulous patient's edentulous jaw, which being a removable denture. A removable denture is also a full mouth restoration.
How long does a full mouth treatment take?
Of course, it depends on what we're gonna do to rehabilitate a full jaw. As I mentioned previously, if dental implants are involved, the treatment takes around 3 to 4 months depending on the healing process. But if the patient has some small gaps and some aesthetic concerns, then we go with dental bridges and it takes around 6 to 10 days depending on the case.
Is full mouth treatment painful?
If the full mouth treatment involves placement of the implants, aftercare is crucial, as I mentioned previously. In terms of the pain, if we are not going with implants and we are just doing bridges or a removable denture, the pain is almost non-existent. After the filing down of the teeth, a slight sensitivity is expected for a while, but we are minimizing it by placing temporary bridges on the teeth that we file down.
And can full mouth treatment fix chewing issues?
Of course, this is the main reason we are doing this treatment for. At the end of the day, the patient is supposed to chew on it. Some patients do come to us with heavy orthodontic or orthognathic skeletal issues. In those cases, we refer patients to advanced treatments to gain the relationship between the jaws again. But for mild cases, if the patient is not capable of chewing because of the malposition of the teeth, mild malposition of the teeth, we rehabilitate these areas and we give the patient a better chewing function.
What are the benefits of full mouth treatment?
There are two aspects. One is function and one is aesthetics. If the patient has problems with either of them or both of them, we fix those issues, because if there are gaps, you cannot chew. If your teeth are malpositioned or if you have issues with the shade of your teeth, we also fix them, and at the end of the day, these are fixed also. So it is a very useful treatment.
Can I choose the materials used for full mouth treatment?
Of course, we give patients a variety of dental materials for the rehabilitation of the jaw, but sometimes there are restrictions in terms of the structural strength of the restoration, and we let the patient know about it.
Can I get full mouth treatment without extraction?
It really depends on the case. If you have hopeless teeth and there is no point to keep those teeth in your mouth, then extraction is mandatory for those cases. Or the existing teeth, if we are going with a bridge restoration and existing teeth are not capable of carrying the loads that are supposed to come to the empty areas, then we might have to replace these teeth with implants. So it really depends on the case, and we decide accordingly.
How long do the results of full mouth treatment last?
We expect a full mouth restoration to last for the lifetime, of course, but it really depends on too many aspects. The patient is supposed to take good care of them, and the patient also has to come to his or her follow-up appointments after the treatment. So aftercare is very crucial.
And how frequent is that follow-up appointments?
We expect to see our patients at least once a year, but for international patients, most of the time it is not possible. So a video call, if the patient have issues with their treatment, would be very helpful after the treatment to foresee the problems that are coming in the long run.
What is the difference between full mouth dental implant restoration and full mouth dentures?
Full mouth dental implant restorations are fixed. You do not take them out while you're going to sleep. But when it comes to dentures, it is a whole different story. Dentures are put on the jaw. They stay put with the vacuum between the jaw and the denture itself. There are some restorations we do with the support of implants and also dentures. We place 2 or 3 implants in the jaw, and the denture is held onto them with a connecting system. And these dentures are more stable than traditional dentures, but you remove them every day and you do the cleaning of those dentures yourself.
Can full mouth treatment improve my facial appearance?
Of course, the loss of teeth causes tissues to collapse, and also the muscles do not work properly and lose their volume. After the placement of the implants and dental restorations, the surrounding tissues start functioning better and their volume increases. Also, the lip support is gained again, which dramatically changes the facial profile.
And are there any dietary restrictions after getting full mouth treatment?
Actually, no, because of course at the end of the day you are not supposed to open beer bottles with your teeth. You gotta avoid risky behavior, but we expect patient to function as usual after the full mouth treatment. There are no restrictions.
Can patient go back to work immediately after full mouth treatment?
Yeah, of course, we expect patient to go back to the normal life after the treatment, but when it comes to implants, there is a primary healing process which takes a week or two, and during this process, the patient might not be capable of talking properly to the placement of temporary bridges. So this period might be a little bit difficult for a patient to get over with it. But after the dental implant treatment, the patient is supposed to go through a primary healing process where there is some swelling, there is some dull pain at some areas, and it might be difficult for a patient to talk during this process. So this might affect the daily routine, but it takes a week or two.